I am Dr. Ganesan, pathologist at Kannappa Memorial Hospital. I am just going to tell how do we diagnose leukemia. After we take a clinical history, the first step is doing a CBC, that is the complete blood count. First, what we do is we will collect 2 ml of sample in an EDTA tube and put it in an automated cell counter and just push it in. So within a minute, this machine is actually imported from Japan called the Sysmex, and it will make all the counts like WBC, RBC, platelets and many other parameters and give the report within 1 minute. Now the result has come. You can see that the WBC count is very high at 2.55 lakhs. The normal count is only up to 14,000. So this is typical of a leukemia. The next step is we take the blood sample and make a slide and stain it and then see it under a microscope. Now, after seeing the smear, I think probably this could be a chronic myeloid leukemia. So we also have facility for the with the AI instrument to read the smear. So put them so you can see these good pictures here of promyelocytes, myelocytes, metamyelocytes and other things. So this is a typical case of chronic myeloid leukemia. Then further step we do a flow cytometry and then a bone marrow aspiration.
Once the peripheral smear suggests it's a chronic myeloid leukemia, the next step is bone marrow aspiration biopsy. So before doing the bone marrow aspiration biopsy, first we have to get informed consent from the patient. First we have to inform the patient about the procedure, then we have to get the consent from the patient. Once we obtain the consent, next we proceed with the bone marrow aspiration biopsy. So what is the position for the bone marrow aspiration biopsy? Generally, we advise the patient to lie on the left lateral position with the knees, both the knees extended up to the flexed up to the abdomen. Then we clean the site of bone marrow procedures posterior iliac crest. So we under strict aseptic conditions, we first clean the site of the bone marrow procedure. Once we have cleaned the site for the procedure, next we insert the needle. So this is the needle. This is the bone marrow aspiration biopsy needle. This needle is known as Jamshari needle. So at the site of posterior iliac crest, we make a small incision. Then we insert this needle. After inserting this needle, we reach the posterior iliac crest. Once the posterior iliac crest is reached, we start to do the aspirate. Once we obtain the aspirate, we give the aspirate for the slides to make the slides for the morphology. Then if we need any extra samples for fish, karyotyping, NGS, we collect the samples. After that, we perform the bone marrow biopsy. Once the biopsy is over, we close the site with gauze and apply a tight pressure bandage. This is the bone marrow aspirate and biopsy procedure. Now we will perform bone marrow aspiration and biopsy procedure.
Relax,